Good morning to you and thank you for joining us. You're actually yourself in lockdown there in Perth. How are you going and do you think this lockdown is necessary?
Morning, Joanna. Unfortunately, the lockdown is necessary because we've already seen that this individual who unknowingly was carrying COVID out and about in the Perth community for 5 days has already infected one other individual. That means that he was spreading the virus, at least in some way, and that means that the authorities have a significant job to trace all the people that he's had contact with over that 5-day period. And the lockdown enables that to happen while spread is contained. So it's unfortunately a necessity, but I would say that when we heard the news yesterday, I was operating at Fiona Stanley Hospital, and there was a kind of resigned frustration, I guess, from all the healthcare workers there, acknowledging it's necessary, but a little annoyed that it's happening again. And I guess I can only imagine what small business owners are feeling, given that really this was avoidable.
So we have seen a small bit of spread at this stage. Do you expect we'll see more cases?
It's really going to come down as to whether this particular individual was a super spreader or not. Presumably the person in the hotel who spread it to other people was one of those super spreaders. But whether this chap who was out and about in Perth for 5 days is someone who produces large amounts of virus and spreads it to the community, we just don't know as yet. But the government need to assume that he was, and therefore get that contact tracing done, which will hopefully be completed over the weekend.
And do you have faith in the contact tracing system in WA?
Yes, I think actually in all states and territories we've got experience now in contact tracing, and it's facilitated by the apps and things that we've all been using as we check into venues and so on. So we're reasonably confident about that. What we're less confident about is the quality of the arrangements in hotel quarantine and why this happened in the first place.
Now, we mentioned in our cross with our reporter just before about the importance of people getting tested. Given there is such a low risk in Australia at the moment, do you think we've seen complacency with people getting tested if they do have these symptoms?
We certainly see complacency in between the outbreaks, and people who have cold and flu symptoms are not presenting in the numbers that they do at other times, when there's a scare. And that was underlined beautifully by walking outside Fiona Stanley Hospital yesterday. I think we saw the same at Sir Charles Gardner Hospital, where there were incredible lines of people who were clearly not going to make it into the testing venue before it shut. And that just demonstrates, I think, the heightened anxiety that is out there, but also that people are doing the right thing when they know there is some risk in the community.
Is it a frustration to you that we keep seeing these issues with hotel quarantine in Australia?
It is a frustration to me, and I think to all Australians, because we have learnt a lot about the virus. We know, and we've known actually for many months, that it is spread through aerosol transmission under certain circumstances. And we've seen hotel quarantine fail in each of our states and territories, except for the facility at Howard Springs, where people are kept further apart in a facility that's more fit for purpose. So there's a couple of things that need to happen. One is everything that can be done in hotel quarantine needs to be done right now. And unfortunately in Western Australia, as in some other states, that is not the case. There are still holes in hotel quarantine that could easily be plugged. And the report from the last outbreak has underlined some of the things that need to be done in WA. But in the longer term, we do also need to be looking at alternatives to hotel quarantine. It was always a short-term measure. At the end of the day, quarantine is a national responsibility, and the AMA would like to see, firstly, us having a Centre for Disease Control, which would be tasked with this sort of problem and protecting Australians, but in particular, standing up appropriate quarantine facilities to make sure that we're not relying on buildings that were never built, their ventilation systems were never designed for this purpose.
Just finally, Doctor, I think a lot of people in Perth will be wondering, this final question is, do you expect that this 3-day lockdown will be extended further?
Well, whether the lockdown will be extended further completely depends on the results of the testing of individuals who've been exposed over the last 5 days in Perth. If we see there are 10 or 15 or 20 people who've then got their own contacts to be followed up, then we will see the lockdown extended. But I think as what happened last time when we had our 5-day lockdown, if the data comes back empty and we're not seeing any other West Australians being infected, then we can expect at least some relaxation of the lockdown on Tuesday.
Let's hope so. Dr. Omar Khorshid, thank you so much for joining us this morning.
Morning, Joe.